When Dr. Elias Harrow told a hallway full of residents that I was too needy to be a mother and too dramatic to be sick, he did not know the quiet woman in the paper gown had already seen the one crack that would make his whole clinic turn its back on him. That was the moment everyone remembers now, because it was ugly enough to make even his favorite nurse look at the floor. But it did not start in that hallway. It started 3 weeks earlier, with a blue paper wristband cutting into my skin, and my older sister Natalie whispering, "Do not embarrass me in there, Claire. He is helping you." I was 34, divorced, and working nights in sterile processing at Briar Ridge Women's Center outside Columbus. I washed and packed the instruments doctors used in the same building where they smiled for billboards. I knew which surgeons yelled, which nurses cried in supply closets, and which doctors acted kind only when a donor was watching. Dr. Harrow was the one the hospital posted on buses. Women called him a miracle. Administrators called him irreplaceable. Natalie called him the reason she finally had a stable job. She was his front office manager. That mattered more than I wanted it to. Natalie had raised me after our mother died, and she still had the voice that made me feel 16 when I disagreed with her. She had gotten me into Briar Ridge after my divorce, when my credit was bad and I was 2 missed paychecks from losing my apartment. So when Dr. Harrow offered to remove what he called a simple pelvic adhesion before my insurance deductible reset, I said yes. He put his hand over mine in pre-op and said, "We take care of our own here." Natalie cried when he said it. I believed him because she did. The first thing wrong after surgery was not the pain. Pain made sense. The wrong thing was the sock. Someone had put only one yellow fall risk sock on my right foot, the kind we gave elderly patients who might slip. My left foot was bare and cold. I remember staring at that single sock in recovery while a nurse I did not know said, "You're awake enough. Sip this." The cup had water, but my mouth tasted like metal. I asked why my belly felt hot. She said, "Normal." I asked if Dr. Harrow had talked to me. She said, "He told your sister everything." Natalie drove me home with the discharge folder closed on her lap. She kept one hand tight on the steering wheel and one hand pressed over the folder, like it might fly open and accuse her. I asked what he found. She said, "Scar tissue. Nothing scary." I asked why I had a fever. She said, "You always run warm when you panic." That sentence landed harder than the seatbelt across my incisions, because panic was the word people used when they wanted my body to stop being inconvenient. By midnight, I was shaking so hard my teeth hit. I called the after-hours line, and a nurse told me Dr. Harrow had left instructions not to prescribe anything stronger and not to send me to the ER unless I was bleeding through a pad an hour. I said my shoulder hurt, my stomach was swelling, and something felt wrong under the bandage. She paused, then lowered her voice. "If it gets worse, come in when we open. Ask for Mara." Then the line clicked before I could ask why she sounded scared. Mara was a recovery nurse with 20 years at Briar Ridge and a face that never gave away hospital gossip. She was also the only nurse who still checked instrument trays with her own hands instead of trusting the label. At 6 in the morning, I stumbled through the employee entrance because I did not want patients in the lobby to see me bent over like an old woman. The yellow sock was still on my right foot. I had put my sneaker over it because I could not bend far enough to take it off. Mara met me near the staff lockers, not in an exam room. That told me something before she spoke. She looked at my lips, touched my wrist, and said, "You need to be seen now." I said, "Then take me back." She glanced toward the front desk, where Natalie was already watching us through the glass. Mara's mouth tightened. Not by him alone. Before I could ask what that meant, Natalie came through the door with her badge swinging. "Claire, patients are checking in," she said. "You cannot come through the staff side like this." I told her I had a fever and something was wrong. Natalie's eyes flicked to Mara, then back to me. "Dr. Harrow is between surgeries. If you want help, you need to stop acting like you work here right now and act like a patient." That was the first betrayal I could name. Not because she was embarrassed. I had seen embarrassment on her before. This was strategy. Natalie was moving me out of employee space and into patient space, where my badge meant nothing and his words meant everything. They put me in exam room 4, the small room beside billing, not the larger procedure room with the ultrasound machine. I sat on the paper sheet in my work hoodie, sweating through the collar. The blue wristband from surgery was still around my wrist, because no one had cut it off. It had my name, my date of birth, and one black line, where the printer had dragged ink through the corner of the label. I stared at that crooked black line, while Natalie stood by the door with my folder under her arm. And I did not know yet that the same kind of mark would later show up on a page I had supposedly signed while I was still too weak to stand. Mara locked exam room 4 behind her and said, "If Harrow sent you home with a fever, Claire, he was not treating you. He was moving you out of sight." For 1 second, I forgot how to breathe, because Mara did not say it like gossip. She said it like a nurse naming a fire. Natalie stood beside the counter with my discharge folder tucked under her arm, and the way she held it told me she already knew that folder mattered. I was on the exam table in a paper gown, my work hoodie balled against my ribs, one yellow sock still on my right foot like a stupid flag. I had come back to the clinic because I was scared I was getting worse. Mara had just told me I was right. Natalie recovered first. "Mara, don't start." Her voice had that front desk calm she used on angry husbands and insurance calls. "Claire is post-op. She's scared." She called after hours twice and got herself worked up. Mara did not look at Natalie. She put 2 fingers against my wrist, watched the second hand on the wall clock, and said, "Claire, answer me fast. Fever how high?" I said, 101.9. "Shoulder pain?" "Yes." "Can you pass gas?" I shook my head, and the movement pulled something hot through my belly. Mara's mouth went flat. "That is not worked up." Natalie stepped closer to the table. Elias already said she had a difficult recovery pattern. Hearing his first name in her mouth hurt worse than the needle bruise in my hand. "Doctor?" Harrow was the man who had cut into me less than 24 hours earlier. Natalie was my sister. She was supposed to hear my pain before she heard his reputation. Instead, she said his name like it was a clean towel she could throw over blood. Mara finally looked at her and said, "A difficult recovery pattern does not explain a belly that hard." Then she turned to me. "I need to look." I nodded, but my hands clenched the paper gown anyway. Mara saw that and softened only a little. "You can say no, but if you say yes, I'm staying in this room." That sentence did something Natalie's comfort had not done. It gave me a door with my own hand on the knob. I said yes. Mara lifted the edge of the bandage. The adhesive pulled at my skin, and I bit down so hard my teeth clicked. The incision itself was small, almost neat. That was the cruel part. From the outside, it still looked like the kind of surgery people told you to stop being dramatic about. Then Mara lifted the lower corner of the dressing, and the smell hit the room. Sour. Wrong. Not strong, but not normal. Natalie's face changed before she could hide it. Mara did not gasp. She pressed 2 fingers beside the incision, barely touching me, and I made a sound I had never heard from myself. She stopped at once. "No more." That was all she said, but it changed the room. My pain was no longer a feeling I had to sell, it was a condition someone had witnessed. Natalie opened the folder too quickly. Her instructions say mild fever can happen. Mara held out her hand. "Give me the folder." Natalie did not move. That was the first time I saw her choice clearly. She was not confused. She was deciding what stayed covered. Mara's hand stayed out. "Natalie." My sister gave a small laugh with no warmth in it. "You don't outrank the surgeon," Mara said. "I outrank silence when a patient is septic." The word septic landed like metal in my mouth. Before Natalie could answer, the door opened. Dr. Harrow walked in without knocking. He was still in his white coat, still wearing that careful public face people trusted before they trusted their own bodies. He looked at Mara, then at the lifted bandage, then at Natalie's folder. He did not look at me first. That was the crack. A good doctor walks to the patient. Harrow walked to the threat. "Claire," he said, gentle enough for a hallway. "You came back to the clinic instead of resting." I was shaking now, but not from fear alone. I noticed what he skipped. He did not ask where it hurt. He did not ask what my fever was. He did not ask why Mara looked ready to fight. He looked at the folder under Natalie's arm and said, "We need to keep this calm." Mara said, "She needs an emergency workup." Harrow smiled at her like she had misread a lunch order. "She needs reassurance and fluids. Anxiety can amplify post-operative pain." There it was. He did not deny my fever. He did not touch my belly. He changed the kind of person I was. Not sick. Anxious. Not in danger. Difficult. I had heard that tone through walls when patients cried at the desk. I had never understood how fast a medical word could become a cage. Natalie joined him. "Claire, You know you spiral when people scare you. That one cut deep because it was old. After our mother died, Natalie had been the one who handled forms, calls, bills, adults. If I panicked, she fixed it. For years, I mistook that for love without a hook in it. Now she used the same history to make me sound unreliable in my own body. Harrow did not have to raise his voice. My sister had given him my weak place. Mara moved between them and me. Doctor. Her abdomen is rigid. Harrow's eyes flicked to the bandage again. I said I'll assess her. Then assess her, Mara said. In front of me. The silence after that was small and vicious. He put on gloves slowly, not because he needed time, but because he wanted the room to remember who usually set the pace. Then he came to the table and pressed high on my stomach, nowhere near the worst place. Tender, he said. Expected, Mara said, lower left. He ignored her. I heard my own voice before I felt brave enough to claim it. Touch where Mara touched. Harrow's hand stopped. Natalie said, Claire. Just my name, sharp and warning. I looked at my sister, and for the first time that day, I did not answer her. I looked back at Harrow. If it's normal, touch it. His face did not break. That was why people loved him. His control had layers. He lowered his hand, but he still did not touch the spot. He pressed beside it, close enough to pretend, far enough to avoid my scream. Mara saw it. I saw that she saw it. Harrow saw both of us seeing it. He stripped off the gloves. This has become counterproductive. His voice hardened by 1 degree. Natalie, call my driver. We'll send Claire to the affiliate observation unit. Quietly. No waiting room. No drama. It sounded generous if you did not know the shape of a trap. Observation unit meant his people, his notes, his version before anyone else touched me. Mara said, no. She goes to the emergency department. Harrow turned on her then, all softness gone. You are a recovery nurse on borrowed hours in my clinic. Mara did not blink. And she is not your property. That sentence should have freed me. Instead, it made Harrow change tactics again. He turned away from Mara and looked at Natalie. If Claire goes through the public ER like this, the center gets dragged into it. Your desk, your staff, your judgment. There was Natalie's interest, clean and ugly. Not just loyalty. Not just fear. Her job, her status. The polished place where she had finally become more than the girl who raised her sister too young. Harrow had given her a kingdom of phones, schedules, and locked doors. Now he reminded her he could take it back. Natalie's face went pale. She looked at me then. Really looked. And for half a second I thought my sister might return. Then she hugged the folder tighter. Claire, please don't make this bigger than it has to be. My belly burned. My fever pulsed behind my eyes. But the hottest thing in me was the realization that Natalie was asking the injured person to protect the people who injured her. That was when I stopped waiting for her to choose me. I swung my legs over the side of the table. The room tilted. Mara caught my elbow, but she did not hold me down. Claire slowly. The yellow sock dragged against the step stool. I looked at it, that one ridiculous sock, and remembered my own workroom downstairs. Fall risk socks came in pairs. Staff did not leave one off by accident unless the patient had been moved fast, interrupted, or hidden under a story before the story was finished. I reached down and pulled the sock off my foot. My toes were cold against the floor, but my head cleared. I held the sock out to Natalie. You told me I was confused when I woke up with one of these. Natalie did not take it. Harrow said, This is not relevant. Mara looked at the sock, then at the bare foot, and something in her face sharpened. Not surprise. Recognition. She had seen the missing half of that story before I had even known there was a story to find. Mara had her hand on the exam room phone when Harrow stepped between her and the wall and told her, in that calm surgical voice, that if she dialed 911 for me, she would never work in women's health again. I was half curled on the paper-covered table, sweating through my shirt, with one yellow sock on one foot and my sister holding my discharge folder like it was a shield. Harrow did not raise his voice. That made it worse. He sounded like a man correcting a waitress, not a doctor blocking help from a patient with a hard, burning abdomen. Mara looked at him for 1 second too long, then reached into her scrub pocket and pulled out her own phone. Then I won't use your wall phone, she said and pressed 3 numbers. Harrow's face changed before he could stop it. Not fear, exactly. Calculation. He turned toward Natalie and softened his voice so fast it felt rehearsed. Nat, help me keep your sister calm. You know what happens when she spirals. Natalie flinched at the nickname. He had used the one only people inside the clinic used for her. The warm little office version of my sister, the one who belonged to him more than she belonged to me in that moment. I'm not spiraling, I said. My voice came out thin, but it came out. My stomach is hard. I have a fever. I need an ER. Mara repeated the same words into the phone, clean and sharp. Post, op, patient, fever, rigid abdomen, shoulder pain, possible internal infection, Briar Ridge Women's Center. Send EMS to the side entrance. Harrow's head snapped toward her at the words side entrance. That was my first real clue that the front door mattered to him more than my pulse. The side entrance had no patients waiting, no donors coming through, no smiling photo wall with his face beside the words excellence and compassion. Harrow moved again, not toward Mara this time, but toward me. He crouched near the table, close enough that I could smell the mint on his breath. Claire, listen to me. If you go out by ambulance, this becomes a circus. You'll sit for hours with people who don't know your case. I can place you in observation myself and keep you comfortable. That was his new strategy. He stopped calling me dramatic and started offering rescue, but only if I stayed inside his reach. I gripped the edge of the table until the paper tore under my fingers. I don't consent to you directing where I go, I said. I want the nearest emergency room. Natalie made a small sound, like I had slapped her. Claire, please don't say it like that. Her eyes flicked to Harrow, and then to the folder. You don't understand what you're doing. I looked at my sister, and the pain in my abdomen got tangled with a different pain, older and cleaner. Natalie had packed my lunches when Mom died. Natalie had signed my school forms. Natalie had slept on the floor beside me the week my first marriage ended. And now she was asking me to be careful with the feelings of the man blocking the ambulance. Then explain it to me, I said. Explain why he's more scared of the door I leave through than the fever I came in with. The siren did not sound dramatic from inside the clinic. It arrived as a flat chirp, then the heavy knock of strangers who did not ask Harrow for permission. 2 EMTs came in with a stretcher, and the room changed because they looked at my body before they looked at him. The taller one, a woman named Keeley, touched my wrist, asked my name, asked what day it was, and pressed on my abdomen so lightly I still cried out. She did not tell me to calm down. She told her partner, "We're moving." Harrow stepped beside her with his polished voice ready. "I'm her surgeon. I'll call the private unit and arrange." Keeley cut him off without looking up. "Nearest ER. She's unstable." That one sentence did something to the air. Harrow was still powerful inside his own building, but he was not powerful over the stretcher. Mara leaned close as they lifted me. "Keep saying what you know," she whispered. "Short sentences. Don't let anyone make you perform normal." Then she slipped something under my palm. It was the loose yellow sock, cheap and thin, and suddenly heavier than the folder Natalie kept closed. "You had one on when you came back to us," she said. "You didn't leave recovery walking steady." She did not explain more. She did not have to. In the hallway, Harrow walked beside the stretcher like he still owned the direction of my body. Staff froze at doorways. No one spoke. He used their silence like a curtain. "This is unnecessary," he said to Keeley. "Her baseline anxiety complicates presentation." Keeley snapped a blood pressure cuff around my arm. "Her pressure is dropping." That shut him up for 3 steps. Then he changed again. "Natalie, ride with her. Bring the file. She'll need someone who can answer accurately." Accurately meant his way. Natalie hugged the folder to her chest. I saw her thumb pressed over the corner so hard the paper bent. At the ambulance doors, I turned my head enough to see Harrow behind my sister. He was no longer looking at me like a patient. He was looking at me like a locked cabinet that had rolled out of the building. "Natalie," I said, "if you ride with me, you ride as my sister, not as his office manager." The EMT partner paused with one hand on the door. He did not know our history, but he knew a line when he heard one. Natalie's face tightened. Harrow said, "That's a cruel thing to say to someone who has kept you alive more times than you remember." There it was. The hook he had in me. He had learned it from her, or she had offered it without knowing. Natalie had saved me before, so now I was supposed to let her decide how much danger counted. The ambulance doors closed before I answered him. For the first time since I woke up after surgery, Harrow's voice was outside a barrier. The sound of it vanished under the engine. Natalie sat on the bench beside me, folder on her knees, eyes wet but not falling. Keely put oxygen under my nose and asked, "What surgery did you have yesterday?" I told her. "What did they tell you before discharge?" I swallowed against a wave of nausea. That soreness was normal. That I was anxious. That my sister would watch me. Natalie closed her eyes. Keely asked, "Did you refuse overnight observation?" My head turned toward my sister before I could stop it. Natalie opened the folder 2 inches, then shut it again. That tiny motion told me the answer before she said anything. "He said the observation beds were for higher-risk patients," she whispered. "He said signing the form only meant you understood the option." My fever made the ceiling light smear above me. "Did I sign it?" Natalie's mouth trembled. "You were still groggy. The ambulance hit a pothole, and pain tore up through my ribs so hard I could not speak." Keely leaned over me. "Stay with me, Claire." Natalie grabbed the rail instead of my hand. That hurt too, but it also cleared something. My sister was not confused anymore. She was choosing which truth would cost her less. At the ER bay, the doors flew open into noise and hard light. A triage nurse took one look at my wristband, my sock, and my gray face, then called for a room before Keely finished the first sentence. People moved fast around me. They cut away the tape from my dressing, and the sour smell that came out made the nurse's mouth flatten. A doctor with tired eyes pressed 2 fingers below my ribs and said, "This is not a panic attack." He said it to the room, not to me, and that made it matter. For once, the sentence was not mine to defend. Natalie stood near the doorway, still holding the folder, while the ER team started lines in both my arms. Her phone kept lighting up in her hand. I did not need to see the name. She turned it over, then turned it back, then finally answered. "Dr. Harrow, I'm in the room," she said, and her voice went small again. The doctor looked up sharply. "Put it on speaker or step out." Natalie froze. That was the first time someone treated her loyalty to him as a risk instead of a virtue. She did not put it on speaker. She lowered the phone and ended the call. Then she walked to my bed and placed the folder on the blanket, right beside the single yellow sock. "Claire," she said, barely loud enough for me to hear over the monitors. "There's a page in here with your name on it that you never saw." The doctor reached for the folder, but I put my hand over it first, not to hide it. To stop the room for one breath. My blue wristband scraped against the paper, and Natalie looked at it like she had just noticed I was still tagged to the place she had helped send me back from. Natalie pulled the hidden page from my discharge folder, and the ER doctor's face changed before anyone said the word signature. Until that second, my fever and my hard stomach had been the emergency. Now the paper in my sister's hand became a second wound, because it said I had refused the exact hospital care I was begging for. I was on a narrow ER bed with a blue band on my wrist, an IV burning cold into my arm, and Natalie stood beside me, holding proof that someone had already tried to make me look like the reason I was dying. The doctor's name was Dr. Patel. She did not gasp. She did not perform outrage for me. She took the page from Natalie, read 3 lines, and said, "Claire, I need you to answer this clearly. Did you refuse transfer to a hospital after your surgery?" I said, "No." My throat felt too dry for the size of that word. "Doctor." Patel turned the page so I could see the bottom. There was a scrawl where my name should have been. It leaned upward, thin and rushed, like somebody had signed while moving. "Is that your signature?" she asked. I looked at it once and knew the answer before my brain caught up. "No." Natalie made a small sound, not quite a sob and not quite a denial. Dr. Patel did not look at her. She looked at me. "Then I'm treating this as a safety issue, not a misunderstanding." That sentence did more for me than any comfort could have done. It put a floor under the room. It did not save me yet, but it stopped the freefall. Then the pain folded me in half. It was not a cramp. It was a tearing pressure under my ribs, like my body had run out of room to hide what was wrong. The monitor above me started beeping faster. A nurse named Denise pressed a button on the wall and said, "Pressure's dropping." Dr. Patel lifted the blanket just far enough to examine my stomach, and I heard the tone leave her voice. "Call surgery now. CT if they can move her in 5 minutes. If not, we go without it." Natalie stepped backward as if the bed had become dangerous. "But Dr. Harrow said her abdomen was expected to be tight." Dr. Patel finally looked at her. "Expected tightness does not smell infected." Expected tightness does not come with a falling pressure and fever. The room sharpened around that sentence. For the first time, Natalie heard a doctor say the thing Mara had been trying to say from the clinic floor. This was not anxiety, and it was not normal recovery. This was harm with a clock on it. A resident came in with a consent tablet, and I almost laughed because of how cruel that felt. Another consent, another screen, another moment where my name could be used while I was too weak to fight. Doctor, Patel must have seen my face change. She took the tablet from the resident and put it on the counter, away from my hand. No one is rushing a signature out of you, she said. Listen to me first. We believe you may have an internal leak or injury from the procedure. You need emergency surgery to find and control the source. You can choose the hospital surgical team. Dr. Harrow does not have to be involved. Natalie said. He's her surgeon. He knows what he did. That was the wrong sentence. Even Natalie seemed to hear it after it came out. Dr. Patel's reply was quiet. That is exactly why he is not the only person I want in this room. My sister pressed both hands to her mouth. I wanted to hate her cleanly, but the look on her face was not clean. It had fear in it, and guilt, and something uglier than both. Calculation. She was not only scared for me. She was scared of what my survival would expose. That hurt more than the forged page. Because I understood then that Natalie had been carrying 2 emergencies since the clinic. Mine was inside my body. Hers was inside her life. The ER doors opened again, and Dr. Harrow walked in as if the hospital belonged to him because every room had always opened for him before. He had changed out of his clinic coat, but he had not changed his voice. Claire, he said, soft enough for strangers. I came as soon as I heard they brought you here. There's been a lot of panic around a very treatable post-op response. Denise stepped between him and my bed without asking permission. Doctor, Patel said, you are not on her care team here. Harrow smiled at that like she had made a small mistake. I'm the operating physician. I can help you avoid unnecessary escalation. His eyes went to Natalie. Not to me. To Natalie. It was only a flick. But I saw it. My sister lowered her hands and became the version of herself he knew how to use. Maybe we should let him explain, she said. Claire, just hear him out. That was his new tactic. At the clinic, he had made me sound unstable. In the ambulance bay, he had tried to sound official. In the ER, where people could see my fever and falling pressure, he became gentle. He made himself the calm man surrounded by hysterical women. He did not need everyone to believe him completely. He only needed them to hesitate. Dr. Patel did not hesitate. The page in her folder says she refused hospital transfer. She says she did not. The signature does not appear reliable. If you have information that affects her current emergency, say it now. Harrow's jaw tightened for less than a second. Then he adapted. She was sedated and distressed. My staff may have misunderstood her. But that is an administrative problem, not a clinical one. He moved one step closer. Denise did not move. Claire, you know me. You trusted me with your surgery. Let me take care of this before it becomes something people twist. There it was. Not before I died. Before people twist it. My whole life narrowed to that difference. I looked at Natalie because I wanted her to hear it too. Her face broke for a second, and then she looked away. She had heard it. She just was not ready to pay for hearing it. A transport tech arrived to take me to CT, but I did not make it through the doorway. I tried to shift onto the transfer board, and hot liquid seemed to burst under my skin. I cried out so hard the room stopped being a room. Denise pulled the sheet back and said, Doctor. Dr. Patel touched my stomach once, then looked at the resident. No CT, or now. The resident ran. The transport tech backed the bed around. Harrow said, That is premature, doctor. Patel turned on him, and her voice cut through every machine. A septic patient with peritoneal signs is not your reputation problem. That was the midpoint of my life, though I did not know it yet. Not the surgery. Not the paper. That sentence. For months afterward, I would remember the exact order of it. Septic patient first, reputation problem last. Someone had finally put me before the story about me. Harrow's face changed then. The softness disappeared. He looked at Natalie again, and this time he did not hide the warning in it. You need to be very careful, he said. Both of you. Accusations made under stress can destroy careers. Natalie flinched. There was his leverage. Her job, her mortgage, her son's therapy copays, the respectable life she had built inside his clinic. He was not just threatening me anymore. He was reminding my sister that if I became a patient with a case number, she became the woman at the front desk who helped send me home. I said, "Natalie." My voice sounded far away, but she looked at me. "Did you see me sign that page?" She closed her eyes. Harrow said, "Do not answer that." "Doctor." Patel said, "She can answer if she chooses." That changed the room again. Not because Natalie suddenly became brave, but because someone had named choice in front of the man who had been feeding on everyone's fear. Natalie opened her eyes. "No," she said. It was barely audible, but it landed. I did not see her sign it. Harrow exhaled through his nose like she had disappointed him at work. Natalie kept going, and this time her voice shook harder. "Mara asked for an ambulance before Claire left the clinic. He told me to mark Claire as discharged and move the chart off the active board." She looked at me, and the shame in her face did not ask to be forgiven. "I did it because he said if inspectors saw an ambulance pickup from our recovery room, Briar Ridge would be finished." No one cheered. No one solved anything. But Harrow lost something in that room that he could not get back. He lost the clean version of events while I was still alive to hear it. The surgical nurse came for me with a cap and a fresh consent form. This time Dr. Patel read it out loud in plain words. "Emergency exploratory surgery. Hospital team. No Dr. Harrow." I had to pause after every few words because pain kept stealing my breath, but my hand was steady enough when I signed. The signature looked ugly and real. I wanted to frame it and burn it at the same time. As they unlocked the bed wheels, Harrow tried one last time. "Claire, if you shut me out now, you may not like what they find." It was meant to scare me back into his control. Instead, it gave me the only answer I needed. "That's why I want someone else to find it," I said. Denise squeezed the rail once, not my hand, not in a way anyone could call dramatic. Just one hard tap against the metal, like a signal that the bed was moving under hospital authority now. They pushed me toward the OR doors, and Natalie followed until a nurse stopped her at the red line. I looked back once. My sister stood on the wrong side of that line, with the discharge folder clutched to her chest and my single yellow sock tucked halfway out of its pocket, bright as a warning she could no longer hide. At the operating room doors, Dr. Harrow grabbed my bedrail and said, "If you let strangers cut into you now, Claire, you may not wake up in time to take back the accusation you just made." His voice was soft enough for a hallway, but every person near us heard the threat inside it. I was shaking under warm blankets, my blood pressure cuff squeezing my arm again and again, and Natalie stood behind him with my discharge folder pressed to her chest like it could still protect someone. "Doctor." Patel stepped between Harrow and my bed. "Move your hand," she said. Harrow smiled like she had misunderstood him. "I'm her surgeon." Dr. Patel did not raise her voice. Not in this room. That was the first time I saw Harrow lose the one thing he loved most. The ability to make danger sound reasonable. He changed tactics right there. He stopped threatening me and became helpful. He told the OR nurse he could give the team valuable context. He told Dr. Patel I had a complex anxiety presentation. He told Natalie, "You know how she gets when she's scared." That last sentence landed harder than the others, because Natalie did know how I got when I was scared. I got quiet. I tried not to be trouble. Harrow had learned that about me, and so had my sister. The nurse at the doors was a square-shouldered woman named Ruth. She checked my wristband, looked at Harrow's hand still near the rail, and said, "Only the assigned surgical team goes back." Harrow tried a new angle. "Then at least send her clinic chart with her." Ruth did not reach for it. She looked at the folder in Natalie's arms and said, "That stays out here until security bags it." Natalie's face went pale. Harrow's eyes moved to her. Not angry yet, just warning her to remember which life he could ruin. I wanted to say something brave before they took me back, but my body had no room left for speeches. I turned my head toward Natalie and forced out, "Don't let him touch that folder." It came out broken, barely louder than breath. Natalie flinched like I had slapped her. For 1 second, I saw my older sister again. The girl who used to climb into my bed during thunderstorms, not the woman who had carried a lie into an ER. Then Ruth pushed my bed through the doors, and the last thing I saw was Harrow standing still while the doors closed on his face. Inside the OR, everything narrowed to simple commands. Breathe into this. Tell us your name. Squeeze my fingers. The anesthesiologist said. You're very sick, but you are here now. That sentence mattered because nobody in Harrow's clinic had said the plain thing. Sick. Not dramatic. Not difficult. Sick. I remember the mask over my mouth, the taste of plastic, and Dr. Taff, Patel's voice near my ear. Claire, the hospital team has you. I held on to that word, hospital, like it was a railing over dark water. Then the room dropped away. I woke up to a machine breathing beside me, and pain that had changed shape. The sharp pressure in my belly was gone, replaced by a heavy, stitched ache that told me I had survived something large. I could not speak at first, because of the tube in my throat. A nurse noticed my panic and put her hand on the sheet, not on my body. You're in ICU, she said. The surgery is over. Blink if you understand. I blinked. She said, your sister is outside. Security is also outside. Doctor, Harrow is not allowed in this unit. That was the first clean fact I woke up to. When they removed the tube later, my throat felt scraped raw, but I asked the only question that mattered. What did he do? The ICU nurse did not answer it. She called the surgeon. That scared me more than an answer would have, because good news came fast, and bad news waited for the person with the right title. Dr. Voss arrived in blue scrubs with tired eyes and a direct voice. He did not perform sympathy. He pulled a chair close enough that I could hear him without him leaning over me. You had a hole in your small bowel, he said. You were leaking into your abdomen. That is why your belly was hard and why your blood pressure was falling. I stared at him because the words were simple and impossible. A hole. A leak. Not nerves. Not pain intolerance. Not my mind making trouble for everyone. Doctor, Voss continued. We repaired it and washed out the infection. You are still very ill, but you made it through the first night. I tried to swallow. From my surgery? He paused, and that pause told me he was choosing words that could survive outside that room. The injury was consistent with an instrument injury from the earlier procedure, he said. What concerned us was not only the injury, it was the delay. The delay. That was the word that made the room tilt. A mistake during surgery was one kind of nightmare. Sending me home while my body filled with infection was another. Calling it anxiety while I begged for help was not an accident. It was a decision repeated over and over until my body almost stopped giving anyone time to fix it. I closed my eyes because crying pulled at the incision. Dr. Voss waited. He did not tell me to calm down. He did not tell me I was lucky. He let the truth sit in the room without dressing it up. Natalie came in after he left, and she looked smaller than I had ever seen her. She still wore the same sweater from the ER, but now there was a paper visitor sticker on it, crooked and half-peeled. She stood at the foot of my bed, not beside it. Claire, she said, and her voice cracked on my name. I could not give her comfort. I had just learned that my body had been leaking poison, while she helped carry a folder that said I refused care. She looked toward the door like she expected Harrow to appear from the hallway and correct her posture. Then she said, Security took the folder. I waited because I knew that was not the confession. Natalie twisted her hands together. He told me if inspectors saw your chart active, the clinic could be frozen. Payroll, licenses, everything. He said Mara would lose her job. He said I would be named as the discharge coordinator who let a patient leave unstable. Her words came fast, but not clean. She was still trying to explain the cage before admitting she had helped build it. I rasped, Did you know I didn't sign that page? Natalie shook her head too quickly, then stopped herself. I didn't see you sign it, she said, and I knew that mattered. That answer hurt more because it was finally honest. She had not walked into the lie blind. She had looked away at the exact moment looking would have cost her something. I turned my face toward the window and saw nothing but the reflected light of machines. Why did you bring it in like it proved something? I asked. Natalie wiped her cheek with the back of her hand. Because if it proved something, then I hadn't chosen him over you. There it was, the small, selfish center under the panic. She had needed the paper to be real because the alternative made her someone she could not stand to be. Before I could answer, Ruth came back in and said, Natalie, you need to step out. Natalie stiffened. Is she worse? Ruth shook her head. No, hospital security needs to speak with you about Dr. Harrow. Natalie looked at me, and for once, she did not ask me what to do. She did not ask me to forgive her first, so she could stand up straight. She took one breath and said, "Okay." At the door, she turned back. "There's something else," she said. "Before the discharge page, before the ambulance, he asked me to move one thing out of your bag." My chest tightened under the monitor leads. "What thing?" Natalie's eyes dropped to the clear belongings sack hanging from the chair, where one yellow sock sat alone against the plastic. "Not that," she whispered. "Something he was afraid you'd remember wearing." By the next afternoon, Dr. Harrow was outside the ICU doors, telling security that Natalie had stolen my yellow sock, and for one ugly second he almost made the theft sound like my sister's idea. I was awake enough to hear his voice through the wall, smooth and wounded, like he was the one who had been cut open twice in 3 days. Ruth stepped between my bed and the door before Natalie could run out there. "He does not come in," Ruth said, "and you do not go out there alone." Natalie stood beside my bed with both hands shoved into the pocket of her hoodie. Her face had gone gray. "He found out I kept it," she whispered. "I swear I didn't give it back." The word kept hit me harder than stolen. She had not only moved something from my bag, she had hidden it from him. And now Harrow knew. Outside the doors, he raised his voice just enough for us to hear. "I'm concerned about chain of custody. She is an employee of my clinic. She has already admitted to handling the patient's belongings." Ruth looked at Natalie's hoodie pocket. "What did you keep?" Natalie did not answer right away. She pulled out the yellow sock first, folded flat like a confession that had been waiting for air. Then she reached deeper and took out an orange fall risk bracelet with my name printed across it. The plastic was bent from being hidden too long, but the black marker line across the clasp was still there. My throat closed. I knew that mark. I remembered Mara drawing it in recovery, because the clasp kept slipping after my wrist got sweaty. I remembered her saying, "I'm marking it so I know if anybody takes it off." I had been too drugged to understand why it mattered. Now I understood. The yellow sock proved I had been unstable enough to be flagged. The orange bracelet proved someone had removed the flag before sending me home. Harrow had not needed me to look healthy. He had only needed the visible warnings to disappear. Natalie held the bracelet like it might burn her. "He told me it was trash," she said. "He said recovery techs overlabel people all the time. He said if a transfer hospital saw it, they would think Briar Ridge discharged a fall-risk patient without proper observation." Ruth's face went still in that way nurses get when they are done being polite. "And did you remove it from her bag?" Natalie swallowed. "Yes, after he told me to, before I drove her home. The room went so quiet I heard the oxygen hiss under my nose. I wanted to scream at her, but the anger had nowhere safe to go inside my body. So I said the smallest sentence I could carry. "You took proof off me." Natalie flinched. "I know." "No," I said, and my voice scraped out rougher. "You took proof off me, and then you told me I was panicking." That landed harder. She put one hand over her mouth, but she did not deny it. Harrow knocked on the ICU door then, not hard, just enough to remind us that even locked doors were something he believed should answer to him. "Natalie," he called, "we need to correct this before it becomes a formal accusation." Ruth opened the door only as far as her body allowed. Security stood behind Harrow. Dr. Patel was at the nurse's station with a chart in her hand, watching. Harrow saw the bracelet in Natalie's hand, and his face changed so fast that even Ruth noticed. Then he smiled. "That was worse. That is clinic property," he said. "It was removed without authorization." Ruth said, "Then you can explain that to security while they bag it." Harrow looked past her, straight at Natalie. "You do not understand what you are holding." Natalie's hand shook. "I think I finally do." The first crack in him was not anger, it was surprise. He had prepared for my weakness. He had prepared for Mara's conscience. He had prepared for hospital procedure. He had not prepared for Natalie to stop needing his permission to be afraid. Ruth brought in a clear evidence bag. Natalie placed the yellow sock and the orange bracelet inside it, one after the other. The bracelet made a small plastic sound when it hit the bottom. It should have been nothing. A disposable strip. A piece of routine nursing protocol. But Harrow stared at it like it had teeth. "Doctor?" Patel stepped into the doorway and said, "Dr. Harrow, you are not to contact this patient or her family while she is under our care." Harrow laughed once. short and sharp. "You're making a mistake," Dr. Patel said. "No, you did." The sentence did not echo. Real life rarely gives you echoes, but it moved through everyone standing there anyway. Security asked Harrow to step away from the unit. He did, but only because 3 people watched him do it. The next turn did not come from a chart or a form. It came from Mara. Ruth had asked one question through the charge nurse. Did Mara want to see the bracelet before Harrow convinced her it was gone forever? 20 minutes later, Mara came into the ICU waiting area, with her hair pulled back badly and her hands shoved under her elbows. She looked younger than I remembered. She looked like someone who had been told all night that one sentence could destroy her life. Harrow was not allowed upstairs, but he had sent messages through everyone he could still scare. Mara stood behind the security officer at first. Then Ruth held up the clear bag. Mara saw the black mark on the clasp, and her face broke. Not loudly. Not neatly. She just stopped holding herself together. "I put that on her," she said. She couldn't make it from the recliner to the wheelchair without folding. Nobody interrupted her. Nobody asked her to make it prettier. Mara kept going because if she stopped, Harrow would get back inside the pause. Her pressure was low. She kept saying the pain was different. Dr. Harrow told me she was dramatic after anesthesia and said he would handle the discharge himself. Then he told me to remove the band because it would confuse the transfer hospital. She looked at Natalie then, not at me. "I didn't know he gave it to you," Natalie whispered. "He told me it was trash." Mara shook her head. "He told all of us something different." That sentence changed the room. It was not just that Harrow had lied to me. He had split everyone around me into separate little rooms of fear. He had told Natalie the clinic would collapse. He had told Mara her job would vanish. He had told the hospital I was anxious. He had told me I was too unstable to be believed. His whole system depended on none of us standing in the same place at the same time. Harrow tried one more move before he lost the hallway completely. He called Dr. Patel's office, then the unit desk, then Natalie again from a blocked number. Ruth answered that last call on speaker, standing beside my bed with security listening from the doorway. Harrow did not know who was in the room. "If Claire keeps pretending she was helpless," he said, "I'll make sure every doctor in this city hears she's unstable." Natalie closed her eyes. Mara looked at the floor. Dr. Patel looked at the phone and said, "Thank you, Dr. Harrow. That call has been documented." The silence on the other end was so clean it almost felt surgical. 3 weeks later, I was back in a paper gown, but not in his exam room. I was in the larger procedure room at Briar Ridge, the one they never gave me when I first came back feverish and bent over. The hospital's quality team had taken temporary control of the clinic during the review, and I had agreed to one independent follow-up because Dr. Patel asked me herself, not because anyone from Briar Ridge deserved my trust. The room had a new lock on the medication cabinet, a new sign about patient transfers, and a new silence that followed people when they recognized my name on the schedule. I did not come there for revenge. I came because my stitches needed checking, because the board needed a patient statement, and because the place that had almost erased me was still a place where other women walked in with paper wristbands and believed white coats before they believed pain. Natalie drove me but did not come into the room until I asked. That was one of the new rules. She no longer stepped into my medical spaces because she was my sister. She waited until I chose her. She had resigned from Briar Ridge 2 days after the ICU call. Not heroically. Not beautifully. She sent the resignation from her kitchen table with her hands shaking, then spent an hour throwing up in the sink because fear does not leave a body just because truth enters it. Mara had been suspended for 48 hours, then reinstated after Ruth Patel and the EMT records backed her statement. She still looked tired, but she looked less alone. Harrow had been placed on administrative leave pending review. That phrase sounded soft until you saw his locked office and the way staff walked past it without lowering their voices. The follow-up nurse gave me a gown and stepped out. I sat on the exam table and looked down at my bare feet. No socks this time. No bracelet either. Just a paper sheet under my legs, and the blue hospital folder in Natalie's lap. Not his folder, mine. Inside it were the things that had survived him. The ambulance report, the OR note, the copied discharge page with the crooked signature, the yellow sock, photographs of the orange bracelet, and a scan of my original blue wristband. The black printer drag on the wristband matched the dragged ink on the refusal page header. That did not prove everything by itself. Nothing in real life is ever that clean. But it proved enough to make the investigators ask why a refusal form that was supposedly completed before discharge carried the same print defect as a wristband logged after recovery. Once they asked that, the timestamps started talking. The page had been printed after I was already marked discharged. The chart had been moved off the active board 9 minutes before Mara called 911. Harrow's addendum had been entered 11 minutes after EMS arrived. He had built his lie quickly. That was why it had seams. I was still looking at the folder when voices rose outside the room. At first I thought it was a patient's family. Then I heard his voice. Harrow. Smooth, irritated, already performing calm for an audience. This is exactly what happens when administrators let unstable patients guide clinical decisions. My body remembered him before my mind did. My hands went cold. Natalie stood up so fast the chair scraped. Mara, who had been waiting in the hallway for the review meeting, said something too low for me to hear. Then Harrow's voice sharpened. No, Mara. You created this circus. Claire wanted attention, and you gave it medical language. The door was not closed all the way. Through the gap, I saw a cluster of residents standing near the nurses' station, frozen in their short white coats. They were supposed to be observing the new transfer protocol. Instead, they were watching a famous surgeon forget which walls had ears. Natalie reached for the door. I said, "Wait." My voice surprised both of us. I was not brave. I was tired. There is a kind of tired that finally becomes stronger than fear, because it has nothing left to protect. Harrow kept going. She was too needy to be a mother and too dramatic to be sick. Everyone in this building knows that. The hallway went still. That was the sentence people remember now. Not because it was the cruelest he had said worse in smaller rooms. People remember it because he said it where silence no longer belonged to him. Dr. Patel was standing at the far end of the hall with the hospital administrator, 2 residents, and the same security officer who had bagged the bracelet. Ruth was there too, arms folded. Mara was standing closest to him, and for the first time since I met her, her face gave everything away. I opened the door myself, slowly. Not because I wanted drama, because my body still hurt when I moved too fast. The paper gown rustled, and every head turned. Harrow looked at me, then past me, looking for weakness he could use. He found a woman with stitches under her gown, a folder in her sister's hands, and witnesses he had not chosen. I said, "You called me dramatic when my bowel was injured. You called me anxious when my pressure was falling. You called me unstable when you wanted my bracelet gone." My voice was rough, not powerful. That made it better. Powerful voices are easy to argue with. Wounded voices make people decide what kind of witness they are. Harrow smiled like he could still save himself. "Claire, this is not the place." I looked down the hallway at the residents, then at the nurses who had stopped pretending to type, then at the administrator whose face had gone white. "That is what you said about the ER." I told him. That it was not the place. That the side entrance was not the place. That my body was not the place. So where exactly was I supposed to tell the truth? No one moved for one full breath. Then Mara stepped forward. She held up a copy of the orange bracelet photograph. The black mark clear across the clasp. "She was not safe to stand when he discharged her," Mara said. Her voice shook, but it did not break. "I marked that band. I reported her symptoms. I asked for transfer. He told me to remove the warning and told Natalie it was trash." Natalie stepped beside her. She did not reach for me. She did not ask me to make her confession easier. "I moved the chart," she said. "I hid the bracelet because he told me to. I brought the refusal page because I wanted it to be true. It was not true." The administrator looked at Harrow, not with shock. Worse. With calculation of a different kind. The kind institutions use when a man stops being an asset and becomes liability with a voice. Harrow tried to laugh. It came out thin. "This is a coordinated attack from frightened employees trying to protect themselves." Dr. Patel walked forward then, calm as a locked door. "No. This is a patient, a nurse, an employee, an ambulance record, an operative finding, and a phone call you made after being told not to contact her." The residents stared at the floor. One of them, A young woman with her badge clipped crookedly, looked at me for half a second and then looked away. Not from disbelief, but because she could not bear what she had just learned about the kind of doctor people had told her to become. Harrow looked around for Natalie first, then Mara, then the administrator. He did not look at me until the end. That was how I knew it was over. He was still searching for the person with the most power in the room, and for once, every person he searched for had stepped away from him. The clinic did not explode. No one dragged him out. Real endings are quieter and more humiliating than that. The administrator asked him to surrender his badge. Security walked him to his office. The residents were dismissed. The hallway slowly remembered how to breathe. I sat back down on the exam table because my legs were shaking, and Natalie stood by the door with both hands empty. For years she had carried forms, folders, bills, my childhood, my fear, and finally Harrow's lie. Now she had nothing to hold. "Claire," she said, "I don't expect you to forgive me." That was the first sentence from her that did not try to buy anything. I looked at my sister, my older sister, the woman who had saved me when we were young and failed me when I needed her most. "Good," I said. "Then we can start with the truth." She nodded, and it hurt both of us. But it did not ask me to bleed quietly for her comfort. Months later, people wanted to make the story simple. Harrow was suspended, then investigated. Briar Ridge changed its discharge policy, its chart access rules, and the way post-op transfers were documented. Mara kept her job. Ruth sent me a card with no sentimental quote, just 3 words inside: "Keep saying it." Natalie and I did not become sisters in a movie ending. She drove me to some appointments. She waited in the lobby unless I invited her back. She apologized without adding reasons. Sometimes I accepted the apology, sometimes I did not. Both were allowed. As for me, I kept the yellow sock in a plastic bag at the back of my closet and the photograph of the orange bracelet in a folder with my name on it. Not because I wanted to live inside what happened, because for a long time, other people had tried to turn my body into a rumor. The sock, the bracelet, the crooked signature, the black line on the wristband, small things, ugly things, disposable things had done what no one else wanted to do at first. They stayed with me. They told the truth when I was too sick to make truth sound polite. And that is why, when people ask me what saved me, I do not say revenge. I do not even say justice. I say a nurse who refused silence, an EMT who chose the nearest ER, a doctor who put the patient before the reputation, and one ridiculous yellow sock that nobody important thought to hide well enough.